Kenyans will be aware that the third wave has been in other parts of the world, including Europe, with devastating effects. And our hope and prayer is that this is not what we are going to experience in our nation. Already, I think you have seen an increase in numbers of the cases that are in our hospitals. We have seen an increase in numbers of those who are on ventilators. We have seen an increase in number on those who need oxygen. And therefore, we must continue with vigilance to ensure that these cases do not overrun our healthcare system.
Of the country experiencing a third COVID-19 wave has indeed come to pass. Just a year since the first COVID-19 case was reported in the country, it is very certain that we are not out of the woods yet. In fact, the numbers keep going up. Hospitals are reportedly filling up with more patients in need of critical care. So what exactly are we in for in this third wave? What do we need to know? The country has also just started administering the COVID-19 vaccine. Will this do much in slowing down the transmission rates and the numbers generally? We'll be breaking down every angle of this topic for you as we engage experts and look at data to make sense of some of these things. I am Akisa Wandera, and this is the front row. To be part of the conversation, always do join us by texting us on 22155, tweet us at KTN News KE, at Akisa Wandera. The hashtag to use is the front row. Let's take a look at our guests at this hour of the front row. Dr. Ahmed Kalebi is a consultant pathologist and founder and group managing director, Lancet Group of Labs, East Africa, and is also a lecturer in the Department of Human Pathology at the University of Nairobi. He'll be joining us shortly to explain some of these things, and especially around testing and why we are seeing the current trends right now. Second, we have Dr. Githinji Gitahi, who's a Global Chief Executive Officer of Amref Health Africa. And until his appointment to Amref Health Africa, Dr. Githinji was the Vice President and Regional Director for Africa Smile Train International. Prior to that, he was the Managing Director for Monitor Publications in Uganda, as well as General Manager for Marketing and Circulation in East Africa for the Nation Media Group. I'll be speaking to Dr. Githinji, and especially on how our health systems are currently. How resilient are they? 1 year on, have we noted any improvements in our infrastructure? And will they in any way come through for the country as we battle the third wave? And finally, to talk about the counties and how they will generally be handling this third wave, I'll be speaking to Dr. Andrew Mulwa, who's the former chairman of the County Executives for Health Forum. Dr. Mulwa is a medical doctor with over 10 years' experience in public health sector management, and he also holds a master's in science in strategic management from JKUAT. He's also the CEC for Health at the County of Makueni. And of course, those are our panelists who will be joining us for this conversation. I'll also be speaking to my colleague, Saada Hassan, who will be helping us just to go through some of the numbers and, some of the graphs that we are seeing. It is reported that in January this year, our positivity rate was at 2%. We're now talking about 17%. When did we drop the ball? This is some of the conversations we will be having at this particular hour. Remember, you can join us. Any questions to the specific panelists, I'll be happy to pose them for you. But just remember, just today, 1,064 people have tested positive for COVID-19, and this is from a sample size of 6,151. And of course, this then brings the total cases to 115,031. The cumulative tests so far done since the first case was reported in the country is 1,379,990. And we'll be seeing these details a bit later. 185 people have recovered in the last 24 hours, and 149 of them from home-based care, and 36 of them have recovered from healthcare facilities across the country. This then brings the total number of recoveries to 88,781. And unfortunately, in the last 24 hours, we've lost 7 Kenyans to the battle of COVID-19, bringing the total number of deaths to 1,925. So 719 patients have been admitted in home-based and isolation care, bringing the total number to 2,223. But then, a very critical number, and I should say we should be paying very much attention to this, 104 patients are currently in ICU in various health facilities in the country. Those on ventilator support are 25 patients, and those on supplemented oxygen are 70, and then 9 of them are under observations. These are the numbers from today, and the number of 1,046, those that have tested positive today, are quite worrying. My colleague Sada Hassan can just come in right now and just help us take a look at some of this graphs that we are witnessing. I will be looking at it from Standard Digital Network. As a group, we've been tracking down these numbers for you. This is what we are looking at. Highest numbers in Nairobi County. Sada, thank you very much for joining us on the show.
Thank you.
And maybe quickly you can help us look at this. Nairobi and Mombasa and Kajiado, as well as Busia, I'm imagining because of the borders, registering the biggest caseload still from the word go. Why is it still quite the trend?
So first and foremost, we know very well that these are, the top cities, Nairobi, Mombasa, and definitely the population is quite high in these cities, and also the people coming in and out of Nairobi city is also quite high. So this quite explains why we have we have high numbers in Nairobi city, also have high numbers in Mombasa County, and Kajiado being close to, the border points. It is also one of the reasons. Also Busia, accounts for that similar case why we have high numbers in these, certain areas.
Because we're being a border town.
Yes, exactly. Okay. And then also, you can consider that Nairobi is also, if you take a look, just walking in the city, you will notice that a lot of Nairobians have really relaxed. It's not like how it was when the pandemic was starting. So definitely it means that we have relaxed. It's not like how we were when the pandemic was starting. All of us, we were kind of really scared. But right now, people are really chilled a bit about it, yes.
And hence why we are seeing the big numbers. And you're going to talk to us about what we're looking at here. This is a graph from April. I'd imagine from last year to where we are now. So we have a spike here.
Yeah, this is actually on deaths, and it can show you that there's a point in time we really recorded a high number. This was last year when it was during the peak time, but right now the numbers, at some point the numbers went low. Yeah, but right now we can see this curve is going up, so it means also the number of deaths are really going up, and it is time for us Kenyans to really, go back to the strict measures, wear your mask, wash your hands as much as you really can.
The death numbers, I hope we are very clear about that. This graph is specifically on the death numbers running from April of last year. Let's just move up a bit and just take a look at the various waves we've seen. We had the first wave, we had the second wave, and now we are dealing with the third wave. So maybe look at how do they differentiate from each other. You have been tracking these numbers for a while. What is unique about this third wave?
All right, so this third wave, the really unique thing about it is that we have really, new variants coming in at this point in time. And when we have new variants, we really don't know much about it, because at least the first wave, we were able to do a lot of research about it. But then now being in the third wave, we don't know much about it. So, at some point we saw that the numbers were really going down here. It was around January, December. The numbers were really quite low. And the positivity rate also at that time was really quite low, at around 2%. But right now you can see the graph is really going high, and right now, actually today we recorded 17%. That is the positivity rate. So this means the number of people who have tested positive out of the sample size that was tested, and also the number of sample size has really gone up. So it means this disease or this virus is really within us, within the community, and that is why we are seeing a lot of these numbers being recorded. Maybe the positive side, which is kind of maybe a good thing, is a number of those positive cases are really not symptomatic, they're asymptomatic. So maybe that is just the bit positive thing about it, but really it means we still have high numbers within us and within our community.
Right. Let's take a look at this last graph before I let you go. On Kenya's COVID-19 infection rates as at 15th March 2021. I believe this was yesterday.
Yes.
What are we looking at here?
So here we are looking at the positive cases as a percentage of the tests that have been done. We can see the numbers are still high. You know, if you take a look, this was the first wave, this is the second wave, and definitely this shows you that we are approaching the third wave. And over time, the numbers have been increasing. Like today, we've seen 1,000 and 60 plus cases. So this tells you that this virus is within us right now. We cannot keep on saying that the virus is not here. We cannot keep on saying that we are not going to wear a mask. It is time for us to, take measures within us as Kenyans, take control of it.
Just quickly before I let you go, so then I would imagine when the graph is high, then they put very strict measures and everyone is observing measures, then it goes down. Then we drop ball a bit, then the numbers go high, and then strict measures, and then we go down. Is it a pattern we are establishing here?
It is a pattern, definitely. The graph can definitely show you that this is a pattern that we have been observing as a country. But then it also tells you that as Kenyans, we are lacking discipline, to some extent. Because if the measures, the strict measures, are reduced, then we record high numbers. And when the measures are really strict, we record low numbers. So it tells you, it goes back to us, our behavior changed.
Right from the top leadership in this country. Sada Hassan, thank you very much for joining us for this conversation. Sada is a health and a science reporter here at the Standard Group. And just quickly, you will be seeing some of the numbers we recorded today on your screen as I have that conversation with the Dr. Ahmed Kalebi, the CEO of Lancet, now joining us live. What you will be seeing on the screens are numbers that have been registered today, courtesy of the Ministry of Health. 1,064 new cases reported today, quite a high for a long time, in a sample size of 6,051, bringing the total number of cases to 115,031. You will keep seeing those details on your screen, on the number of people who are currently in ICU care, those in critical care. And at this point, let me just bring in Dr. Ahmed Kalebi, who's the CEO of Lancet. Dr. thank you very much for joining us here on the front row. Thank you for waiting on for a bit for Sada to explain some of these details for us. When we say we are on the third wave now, Dr. what do we mean?
When we say we are on the third wave, basically what we mean is that the numbers have started rising. And basically, let me just explain what a wave is. Just like you can talk about the wave in an ocean, the currents. So you find rising wave, in other words, something is intensifying, going up to some extent, and then after some time it goes down. Just the same way you can have, for example, when people are making noise in a stadium, for example, you can talk about sound waves. So the sound intensifies, reaches to a peak, basically what we are talking about, crescendo, then it goes into a descendo, and then after some time it starts going up again, and then goes down, so you have an increase in the amplitude, it goes down, then again comes up, and almost like a pattern as you were discussing earlier with your colleague. So basically what we saw in May, June, July last year, that was the first wave. We hit the highest peak in the first wave came around July, then it went down in August, September, then it started going up again back in, if you remember, October, and the peak was again in November, and that was even a higher peak than in the first wave. Then it went down. Then we had a very good December, January, February. Then things started going up again, and right now what we are seeing is we are in the middle of the ascending part of the third wave. We don't know how high that third wave will hit, but we definitely are on a third wave. So we are going to talk about the numbers going up, going down, up, down, and now we are on the third one, and we might be talking about more waves until this pandemic is finally over.
So we really, at this point, we can't really talk about after COVID. So how long do we expect to see waves and waves until it goes? What kind of pattern do we expect to see as months and years go by?
So we have some precedents in the past. This is sort of like a once-in-a-century event, literally a once-in-a-lifetime pandemic. The last pandemic that hit was the Spanish flu, if you remember, in the 20th century, 1918. And what they saw was the pandemic took about 2 years to 3 years before it completely died down. In other words, they thought that maybe it's over, then it comes back and people will die in their hundreds of thousands. So based on that and the current modeling, we expect that this pandemic will continue perhaps up to 2023, maybe even up to 2024. It might not be as intense as it is now, but we are certainly going to be living with this at least through to next year. And when you talk about living with it, it means we'll be seeing situations like this. In one time, everything looks okay, then all of a sudden we are seeing more people getting to hospital, more people becoming sick, and that's what we call the wave. And it will continue like this until we either get enough people vaccinated and they get immunity, and that is called herd immunity, or enough people getting sick because of the infection and they recover and then they have immunity.
A lot of people currently, and it piqued a lot of curiosity, and especially even in the newsrooms, people are complaining about being more sick than, what we have seen previously. Any chance that perhaps there's a new variant? And even so, how much surveillance are we doing in this country to just monitor whether there are new variants, and how are we going to handle that in the event it happens?
So there are two questions. There are two questions that you have asked. Point number one is about are we seeing new symptoms, or are we seeing a new way of presentation of this virus currently? In my view, the answer is not quite, because we've seen the same symptoms before in terms of upper respiratory symptoms. Some people have GI symptoms like diarrhea and the rest. Other people have rashes. People have a loss of sensation of smell and taste. Those things have been there before. I guess what's happening before, we didn't know much about the virus, even the public. And we used to be told that the most common symptom of COVID is mainly dry cough rather than wet cough, no running nose, and we'll be told about things like fever. That's why I used to monitor temperatures. But now what we are seeing is that more people are presenting, the people with symptoms. And remember, not most people are actually asymptomatic, but the few people who have symptoms, they are now presenting with things like headache, running nose, they are presenting with diarrhea, a lot of them are having sore throat. People are now more aware about this, the flu-like symptoms, and people are losing sensation of smell. But because we are now more aware about the symptoms, we are tend to think that, oh, perhaps it's a new way it is presenting, but it's not quite. It's just that we are just a bit more alert about it. And if you look, before people will be asked, for example, as a doctor, patients will come to us for testing, and we'll ask them, do you have any symptoms? And somebody say, no, I don't have any symptoms. And when you test them, they are positive. Later when you ask them, they'll say, oh, maybe I had a bit of fatigue here, maybe I had a bit of headache here, but actually those are the commonest symptoms of COVID. But because people expect that COVID will be something so devastating, you'll end up in ICU. When you ask people, do you have any symptoms? They say, no, I don't have any symptoms. But now people are more alert, and people will tell you, oh, I'm going for a test because I was just feeling fatigue. So that was the first part of your question. Yes. Now the second part of your question, are we actually having a new variant, and are we testing for it? The answer is yes. We have a new variant of COVID, actually several variants of COVID. Just like most viruses, the viruses during a pandemic or in an epidemic, they'll continue mutating. That's how the virus progresses and survives. Some of the mutations, most of them will actually not cause any much effect in terms of how lethal or how virulent, as we say it in science, the virus will be. But what we are seeing right now is that there are some variants of significance that are more transmitted, and they can even cause more infection and more disease. So we're talking about the South African variant, which was discovered first in South Africa. There's a UK variant and there's a Brazilian variant. They have been reported in this country, but we have not received enough data yet from KEMRI, which is the body mandated to be investigating this, to release and tell us what percentage of the infections that we are seeing are actually the new variants. But definitely I can say this for a fact, and the positivity rate is showing. We're actually having a very high positivity rate, and we're having increased infection for the last 2 to 3 weeks.
You being the CEO of Lancet, let's talk about testing now. And I'm glad you've mentioned the positivity rate. We're at 17% today. January, we were at 2%. So even as we go about testing, what kind of unique trends, if any, are we seeing?
So right now, I'll say this week is the worst we've seen, and I'm sure it's going to get worse over the next few days. The positivity rate is going quite high. I think it might even surpass the positivity rate that we saw with the second wave in October, November. And one of the interesting things we are seeing, even in terms of the genetic, the number of genes that these variants are expressing, and what we call the viral load, in other words, the CT values or the psychothreshold values that we are seeing in the lab is quite intense. You are seeing a lot of people coming with very high viral loads very early on in the disease. What we used to see earlier on is that most people will come with low viral loads, but now we are seeing quite high viral loads. I mean, like, there's something we call about CT value, which is inversely proportional to the viral load. Most of the time, you expect to see a CT value of between 20 to 30. That is high. And then it goes down up to 40, and by the time it gets to 40, somebody is actually clearing the infection. Most of the patients we're actually seeing at the moment, their CT values are actually less than 20, which means people are coming with very high viral load. Either it's because they're coming quite quick and testing early, but I also think that there's something peculiar about this virus that we are seeing at the moment, and I'll be very interested to hear what Kemri will tell us in terms of the genomic sequencing or the determination of the genetic variants that we have at the moment.
About our testing capacity currently, we've been at this for a year and now witnessing high numbers. Are we testing enough as a country?
So on one hand, we have a very high testing capacity for sure. If you remember back in March, April, actually in March we only had 2 labs. Both of them were government labs at the National Institute National Influenza Center and Kemri. We only had 2 centers that were testing under the WHO and the CDC. Then later we ended up with about 11 labs by June, July. But actually currently we have more than 70 labs that are actually able to test for COVID using PCR. And you remember we also have a new test, that is the antigen test, which can be done as point of care, and a lot of the hospitals, public, private, and even small clinics are able to do that now. So the testing capacity has definitely increased. The issue then is, are we testing enough? Unfortunately, I'll say no, because if you look at the numbers, there was a time we were testing up to around 8,000 sometimes last year, or even more, but now we are hardly talking about 5,000, 6,000, which means it's not enough, because we should be testing more than 10,000. One of the problems is that most of the people who are being tested, both in public or private, are people who come out voluntarily, and they're coming to test because of a particular need. Perhaps they're traveling, or perhaps they're testing because of work purpose, or perhaps they're testing because they are unwell. But we're not doing what we used to call mass testing, or we're not doing wide testing in the public out there. And that can be attributed perhaps to the cost of the testing, because it's not free. Even in public, there are certain costs to be paid. Also, the other aspect to it is the accessibility of the testing. So I think in terms of the actual number of testing, we're not testing enough.
And in the same breath then, contact tracing. Initially, we did a bit of that sometime last year, and especially right at the beginning. We don't seem to be doing much of contact tracing right now. How will this then impact this current war that we are facing, and especially with the skyrocketing numbers we are witnessing?
So I have to explain something perhaps about contact tracing. You know, contact tracing was quite useful at the very early stages of the epidemic, because one person coming into the country with COVID can, you want to trace that person so they don't go infecting others. But when you reach to a point where there is community spread, widespread community spread of infection like we are talking about right now, I'm sure we have had people in, for example, at the standard group who are positive. So if somebody, let's say like 10 of your people are positive at your office, there is no point of starting to try and trace each and every of them, because you don't know whether this person got infected in the matatu or they got infected at the pub. So at this point, the actual point of contact tracing was to try and limit the infection, but at this time it's everywhere and it's anywhere. So right now what is most important is to pass the message out there that anybody who has symptoms, anybody who has tested positive, they must isolate. Remember, before we'll do contact tracing so that the people can be taken into isolation. Unfortunately, that time we used to have this mandatory forced isolation so that they don't go out spreading to the community. But right now, you're not going to be starting to trace everybody and putting them into isolation. What needs to be done is the people themselves, they need to take ownership. If you have any flu symptoms, even if you have not tested, stay home. Just like for any normal flu. If you have a normal flu, when you have flu, stay home, because if you get out there, you are going to infect people. Certainly, if you have been tested positive, you really want to stay away from people. You want to stay away even from work because you can infect people. So right now, it's not about the contact tracing. It's more about the public messaging. Of course, it is still important, if possible, to be able to call each and everybody who is tested positive and advise them. But again, we don't have the capacity because the numbers are going up. And if you remember, some of the contact tracing centers, some of them had been dismantled. We have had issues of personnel and coverage. So these are all factors that have to be considered here.
So then the responsibility, what you're saying is the responsibility has humongously been thrown back to Kenyans.
That's the reality, because, as I said, if in the early stages, you're talking about tracing 1, 2, 10 people, 50 people in Nairobi, perhaps in the counties. But right now, literally, if you ask me, literally every other person out there might be infected. That is the reality. And if most people are testing, which we are not doing enough testing, and that is being reported to the Ministry of Health, of which that is also done at the county level, you realistically cannot start tracing everybody and saying, who did you come into contact with? Because that is immaterial at the moment. If I got infected, unfortunately I've not had any COVID and I've had my vaccine, but let's say if one of the workers, like one of my colleagues recently tested positive at the office, so immediately we told him, go home, isolate. His family tested, some of them tested positive, others were negative. But you're not going to start trying testing, oh, where did you get this infection from? He could have gotten it from the house help. He could have gotten it from his friend or his visitor. So you're not talking about the government shifting the responsibility. You're talking about that is the practicality at the moment, that when people test positive, they should isolate. If people have symptoms, they should isolate. If people have been in contact with other people who are positive or have symptoms, they should quarantine. So there's a difference between isolation. Isolation is for somebody who is tested positive or somebody who has symptoms, and quarantine is for somebody who has been potentially exposed and they want to stay away until they see within 10 days do they develop any symptoms. So this is now a citizen responsibility. You cannot actually have it done by the ministry. It's not possible at the moment. Yes.
It's not practical. I want us to take a look at something President Uhuru Kenyatta said in his last address to the nation about 4 days ago, before we come back to the conversation of the vaccine. Let's take a look at that.
We were wounded but unbound in the last 1 year. And truth be told, we are yet to emerge from what I previously referred to as the fog of war. In addition, I called it a fog of war because the COVID enemy has remained unseen, and its theaters of war are still unidentified, and its rules of engagement are erratic, miscellaneous, and unwritten. What is worse is that the enemy has also developed mutations. If we were dealing with one variant of the virus in the last 1 year, a new strain has also emerged, or new strains have also emerged in Britain, in Brazil, and in South Africa. We do not know to date how this will spread, nor do we know that the havoc that it can possibly rain on our population.
President Uhuru Kenyatta there during his last national address on the COVID-19 guidelines. And I'd want to ask a question then on the new variants, emerging variants that the president is talking about there, and what perhaps the vaccine can do to slow down transmission rates. But there are also other questions coming in, Dr. Kalebi, from our Twitter handle. Colin Jarvis is asking, ask Dr. Ahmed Kalebi, Dr. Githinji, and Dr. Mulwa whether they have been vaccinated. You've already said you have, since they're health workers. And also ask them why the Ministry of Health has not come out to do enough to educate the general public. So continuous education of the public, you'll be answering that for us. And he still goes ahead and says it is very important that we adhere to the MOH guidelines to curb and reduce infection rate. Ask the panelists whether it is possible that this blood clotting is as a result of rushing the process of preparing the vaccine, especially the Oxford AstraZeneca vaccine. Those are two questions, Dr. Kalebi, and perhaps let's start with the vaccine already in the country. We have seen frontline workers like yourself already vaccinated. At what point will we say that then this vaccine, at what point does it translate to slowing down the transmission rates? How long would we have to wait, and how much would we have to do for this reality to come?
One of the big surprises and quite a big disappointment is that a lot of the healthcare workers, and when you talk about healthcare workers, you don't just talk about doctors or nurses or people working in the medics for that matter. Even like the security guards, the porters in the health facilities. These are all healthcare workers because they are the most vulnerable to getting infection because they are getting in contact with sick people, and also they are the most likely to spread it to other people. So unfortunately, which is quite surprising, we're not getting as much uptake. I was thinking that there'll be a pandemonium and there'll be a scramble for the vaccine. When I went to get my vaccine at Bagavi, it was completely empty. And truth be told, it's ridiculous that even medical workers are questioning and being skeptical. I can understand there's been a lot of conspiracy theory, but the uptake has been very, very poor. But as one Kenyan said, somebody said, Kenyans like deadlines. Perhaps they should be given a deadline and told the deadline is next week, Wednesday, and then you see everybody scrambling at the last minute. But the uptake, to be honest, has been quite poor.
Dr. Kalebi,
so that is one aspect of it.
Yes,
yeah.
Yes. Maybe finish your point. I've cut you short.
And then on the second aspect of it is that with the vaccine now available, the vaccine we are talking about currently is very limited quantity. Just barely enough for frontline workers. You're talking about healthcare workers, the security agents, teachers. So if those people are to be vaccinated, you're talking about 1 million people being vaccinated before you get another 10 million doses. So this vaccine that we have currently will have limited impact on slowing down the infection or the wave because we're not going to achieve enough herd immunity. Yeah. But about the side effects of the virus, sorry, the side effects of the vaccine, yeah?
Right. Dr. Kalebi, I'd ask you to spare us another 5 minutes to just respond to the two questions that have come in, perhaps one more. But I want us to quickly take a quick break. Dr. Kalebi will be with us for another few minutes just after the break to respond to some of your questions on the vaccine before I let him go. You're watching The Front Row. The hashtag to use on our social media platforms is The Front Row. Any comments, any questions? The uptake of the vaccine, as Dr. Kalebi says, is poor, surprisingly. So what are your issues with this vaccine? We'd love to hear your thoughts on that and perhaps how the country is handling this third wave. You're watching The Front Row. Let's take a quick break. We'll be back with more.